Thank you for joining us for this episode of This is Getting Old, Moving Towards an Age-Friendly World. This 10-part series is sponsored by AARP's Community Challenge Grant and George Washington University's University Seminar Series, and is brought to you by Melissa B., PhD, in collaboration with GW Center for Aging, Health, and Humanities. Welcome to This is Getting Old. I'm your host, Melissa Batchelor, and today I'm going to be sharing a recent initiative that I've been working on with some colleagues called the AARP Age-Friendly Social Innovation Challenge. This is a 10-part special series, and today we're going to be talking about part 2, which is abuse, fraud, and neglect. So this series is related to several regional events that we've held at George Washington University Center for Aging, Health, and Humanities with our 5 regional age-friendly municipalities and our multiple multi-sector partners. If you missed the overview, please check out part 1, which is episode 89. And if you're looking for it on my website, Melissa B. PhD, or on my YouTube channel, you can just Google the title AARP and it should come up for you. So in a nutshell, the morning session was spent learning about design thinking, and then the participants were paired off by domains of interest. And these domains are reflective of the World Health Organization and AARP's framework for age-friendly cities and communities. So as I said earlier, this episode is focused on abuse, fraud, and neglect, but also stay tuned at the end of the episode to hear about some different resources that may be helpful to you or someone you know or love who may be a victim of abuse, fraud, or neglect. There are a lot of issues related to these 3 different concepts for older adults. So in order to focus the group's thinking and problem solving, a scenario was designed by our design thinking team. From there, the group devised 5 different ideas for solving this problem. And then the group chose one of those to develop an innovative solution for. The participants included university students from the DC metro area, older adults, and local leaders who live in the region and work in the age-friendly space. Groups were free to come up with ideas based on what they felt like was the biggest priority for the subject of their scenario, and they were instructed to think about solutions without concern for practicality, financing, or what policies would need to change in order to make this solution actually a reality. So as you listen, you may have an idea for a solution or know of a program that would help older adults and their families facing similar challenges. Please add your comments below to this video, and we'd love to hear from you. So now let's listen in to hear the scenario, the 5 different ideas they had, and then the one innovative solution.
We were the abuse, fraud, and neglect group, and we were a team that was thinking about, this issue around a particular scenario. So we had started with a woman whose name is Alberta, who's 79. She was a manager at a local store and really took pride in that. She is now retired and is living with her daughter and family in Maryland. Unfortunately, the daughter and the kids are at school and work a lot of the day. And so as one individual in our group made this really great point, there's only so much cleaning and whatnot that she can do at home. So one thing that happened to her is her daughter was just a little bit upset when Alberta answered the phone and a salesperson called, convincing her to buy a lot of magazines. And we had kind of inferred that was a scam. And now Alberta is not allowed to use the phone when her daughter isn't there. And her daughter is also extremely busy. So that doesn't leave a lot of time, for how Alberta is going to, go about the rest of her day. So she's at home, but, we saw several issues. And so I'll go into that in the next slide. So in the next slide, this is a little bit small, so I'll try and summarize it. What we were finding is, we got into this great conversation about, what exactly are the problems that she's experiencing. And a lot of the issues that the group was seeing were these issues of social isolation and loneliness and susceptibility to, phone scams. We were seeing that she needed socialization and isn't used to not working. She had been in this position of, she had been the person with all the knowledge and now is at home and is not using all of that ability. There was a role reversal between her and her child. And then we also noticed that there is a significant amount of strain from her daughter. She's extremely busy, and maybe there is a lack of awareness about what is available in the community. And I think another point that we found is that whatever solution we were to create, there should be some form of at least acknowledgement of the cultural component that exists between, you know, her and her daughter. So from all of those examples of problems that exist in the scenario, we pulled a couple of questions, or we pulled several questions, you know, what are some problem statements? And what the group had voted on and kind of decided on is, and you can go to the next slide, is this question of how might we decrease the social isolation that so many people like Alberta experience so they don't fall victims to these scams. So we kind of looked, okay, so if the scam is experiencing and the reason for that is social isolation, how do we, or if the problem is a scam, but if we kind of remove ourselves like one step back from that, you know, problem, one of the root problems is that this idea of social isolation. If she were more socially engaged and, you know, has something to do and is using all of her, you know, wisdom and experience, you know, perhaps this would happen a lot less. So if you move on to the next slide, we thought about this idea of a service-based model, kind of akin to, it's not really necessarily like an Uber or Lyft, you know, like a ride share, you know, pure and simple, but there is sort of like a service component to get people together. A single stop service that connects peers with their wider community through multiple means. And we called it Silver Social Connect. But, you know, I think from the conversation we had previously with Larry, I mean, the conversation kind of, you know, stems through like, you know, maybe there is also a little bit of ageism, which I think we kind of touched on in our group. You know, how do people see themselves in this is another thing to think about. So, you know, is there perhaps an opportunity to do a transportation partnership through local governments and businesses, you know, even some of the larger businesses out there? And, you know, perhaps there's a peer network of drivers and passengers that have similar age groups, interests to get each other to different events and social activities. We recognize that, you know, this is something that could very well build off of social media, but not everybody has access to that or wants to use it. So is there a telephone component, you know, that could allow it to be brought to a larger group of people? And you can go to the next slide. You know, potential steps could be to even before starting the service, it would be really, the service would be remiss if it didn't actually figure out, you know, who wanted to do what, to figure out, to create a service that is going to, you know, be beneficial to the people that, you know, it wants to kind of connect. So being able to pull seniors, not just at different centers or groups, but really beyond that and thinking about a much larger scope of people. We were thinking about different models similar to Meals on Wheels, where, you know, perhaps people could call in to a number or to be contacted, you know, from a service like Meals on Wheels, you know, to get them to an event that they were interested in. And we were also thinking about the infrastructure component. You know, if there are users without access to a smartphone, you know, there are different, you know, different localities have sort of a 211 or 311 number line to kind of get local citizens, you know, access to different services. You know, might there be some sort of like cross-pollination with that? And, you know, could this, to kind of spread the word about it, you know, this organization was thinking about, you know, how could, you know, this be broadcast to a wide group, you know, potentially looking at AARP as a model for, you know, what that marketing could look like.
So I would like to thank all the participants in this group for their time, effort, and energy. And as you can see, the group identified a variety of problems and ideas for how to meet the needs that were embedded in this particular scenario. So anyone that's worked with older adults knows that they can face complex challenges, and I appreciate this group for sharing how they arrived at the solution of the Silver Social Connect program. There are some existing programs like NV Rides that I've done episodes on here for the DC metropolitan area, but not all communities are lucky enough to have this type of resource. You may have others. You may also have another idea for a solution or know of a program that would help older adults and their families facing similar challenges. Please add your comments below this video or on my website where this episode can be found, melissabphd.com. We'd love to hear from you. And if you or someone you know or love is a victim of fraud or a scam, please call the U.S. Senate Special Committee on Aging's fraud hotline at 855-303-9470. Again, that's 855-303-9470. Or if you'd like to learn more, I encourage you to review their annual report, which is linked in the description below this video. Or you can go to the Special Committee for Aging's website, go to the resource tab, and that drop-down box, you can click on the fraud book to get the latest copy. Also, if you think that someone that you know is a victim of abuse or neglect, you can check out the State Resources section at the National Center on Elder Abuse website, or you can call the Elder Care Locator at 1-800-677-1116. Again, that's 1-800-677-1116. An especially trained operator will refer you to a local agency that can help. Thank you for joining us for this episode of This is Getting Old, Moving Towards an Age-Friendly World. This 10-part series is sponsored by AARP's Community Challenge Grant and George Washington University's University Seminar Series, and is brought to you by Melissa B., PhD, in collaboration with GW Center for Aging, Health, and Humanities.